then you are able to understand the structures that are present inside and its function. Enumerate the relation of the orbital cavity and its clinical aspects. What is the clinical significance of different structures that are located, and what will happen if they are injured or get damaged? This is a slide showing the bony cavities. These are the orbital cavities that are pyramidal in shape.
डॉक्टर लुबना,
Yes.
थोड़ा सा माइक के करीब करके बोल रहे हैं, आवाज नहीं आ रही बच्चों को.
Mic, yes.
ठीक है.
Mic.
कैमरे में ही है, कैमरे में ही लगा हुआ है.
So we have this orbital cavity, and it is pyramidal in shape, having an apex, a base, and it is four-sided structure. It is a bony structure that lodges the eyeball, and eyeball can move easily inside this socket. This socket is four-sided ball, but it is pyramidal in shape, having an apex and a base. We will discuss how the apex of these bony orbits are formed, and they lodges the eyeball. They are present on both sides of the face. Now, that are present in the orbital cavity, ethmoid, frontal, lacrimal. Just have a look on these bones. So many bones are present to form these orbits paired structures that are present on both sides of the nose. Ethmoidal, frontal, lacrimal, maxillary, palatine bone, sphenoid bone, and the zygomatic bone. These are the bones that will help to form the orbital cavities. This is a slide showing the four-sided orbital cavity having the medial wall, the lateral wall, the superior wall, or we can also say the roof and the inferior wall and the base. Now the apex, I'm giving you a brief summary regarding the apex and the base. What we call this apex. The apex is a pointed structure, the point where the optic canal is present. This is the narrowest point when you keep your hand inside. That point where the optic canal is present is called the apex, and the base is what we call the whole orbital margin. This is the base. So it's a pyramidal cone-shaped structure. So the apex is towards the optic canal, and here we have the base. Now the walls, superior wall, inferior wall. This is the medial wall, and here we have the lateral wall. We will discuss in detail what bones are involved to form the superior wall, or we can also say the superior wall or a base, and the roof and the inferior wall are a base, the lateral wall and the medial wall. The lateral wall is the thickest, but it is thicker, but it is most vulnerable to the injuries and to the direct trauma. This is the lateral wall. Now, first we will discuss the roof, the superior wall, how it is formed. The superior wall is formed by the orbital plate of the frontal bone. Here we have the orbital plate of the frontal bone. And by this orbital plate of the frontal bone, the eyeball gets separated from the anterior cranial fossa. This is the significance of this bone, the orbital plate of the frontal bone. This is present between the eyeball and the anterior cranial fossa. If it is not present, the eyeball will communicate directly with the contents of the anterior cranial fossa. So here the bone that will form the superior wall or the roof of the orbit is the orbital plate of the frontal bone. Now the lateral wall, which is the thickest, is formed by four bones. Four structures are present. Number one, the ethmoidal bone, orbital process of the ethmoidal bone, the lacrimal bone, the maxilla, and the sphenoid bone. The sphenoid bone also part is sphenoid bone and the palatine, not the maxilla. Maxilla will form the inferior wall. I am repeating again. The orbital process of the ethmoidal bone, the lacrimal bone, this will form the lateral wall. The palatine bone has small part, and the sphenoid bone. This will form at end and tip of the sphenoid bone. This will form the lateral wall. The lateral wall, I told you, is the thickest, but it is most vulnerable to the direct trauma, motor vehicle accident, road traffic accident. We will discuss in detail. I put some slides regarding to the clinical anatomy of the orbit. Now, moving on to the inferior wall or the base. The base major part is formed by the maxilla. Here, just have a look on this slide, the maxilla. And a small part, 1/3 part is also formed by the zygomatic bone. Maxilla, zygomatic bone. This will form the inferior wall. Now, what left? The medial wall left. The medial wall, just have a look on this slide. This medial wall is formed by zygomatic bone, frontal process of the zygomatic bone. The greater wing of the sphenoid also participates to form the lateral wall. Frontal process of the zygomatic bone and the greater wing of the sphenoid bone. So we discuss in detail the walls of the orbit and the orbital margin, how it is formed by the 4 different walls. Apex, the pointed part that is formed by the optic, the area where the optic canal is present. This is called the base, that is the whole orbital margin that includes the 4 sides. What are these 4 sides? Superior wall, also called roof, inferior wall, also called base. If this inferior wall is not present, the eyeball gets in direct contact with the maxillary sinus. Lacrimal bone lodges the lacrimal sac, and lacrimal sac contains a membranous structure that is called the nasolacrimal duct. Mucous membrane, it is made up of whole mucous membrane. And if this is not present, what will happen? The eyeball, lacrimal bone, for example, if it is absent, what will happen? The eyeball will come in direct contact with the nasolacrimal duct, and the nasolacrimal duct, the function of the nasolacrimal duct is to drain the tears. Here we have the medial wall, and this medial wall is formed by the sphenoid bone and the zygomatic bone. This is the lacrimal bone. Four walls, which we discuss in detail. A roof also called the superior wall, floor also called the inferior wall, medial wall and the lateral wall. Superior wall, inferior wall, medial wall, lateral wall, apex and a base. Now the contents of this orbital cavity. Contents: eyeball, that the main content by which the orbital cavity lodges the eyeball. The fascia. Fascia is very important. We will discuss in detail the tendons, fascia, the suspensory ligament, orbital septa, muscles, extraocular muscles are present, vessels, ophthalmic artery, and nerves. Nerve 2, there are 12 pair of cranial nerves, of which second, third, fourth, part of the fifth, all these are related to the orbital cavity. I'm repeating again: second, third, fourth, part of fifth, optic, oculomotor, trochlear, and the sixth. All these are related to the orbital cavity. Now, the fascia. These are the orbital openings. This is all about the walls of the orbital cavity, the lateral wall, the medial wall, the superior wall, and the inferior wall. And now look at this slide. The lacrimal fossa is present on the medial side. Okay, this is the medial wall, and here we have the lateral wall, which is the thickest wall, and that is formed by the two things. Here we have the most important inferior wall, the superior wall, and so many structures. Infraorbital foramen is present over there. Superior orbital fissure. Now the fissures, 2 or 3 important fissures and foraminas are present, and the structures passes through these foraminas. Now in my previous slide, here is the lacrimal bone, and that is the medial wall. Okay, getting my point? This is the lateral wall. I think I told you opposite. This is the medial wall because the nasolacrimal duct is related to the nose and it tears the lacrimal gland. And here we have the lateral wall that is formed by the frontal process of the zygomatic bone and the greater wing of the sphenoid. Getting my point? Now the fascias, before proceeding to the fascias, just have a look on the fissures and foraminas that are present in the orbital cavity. You can see in this slide the superior orbital fissure. Here we have the inferior orbital fissure and the optic canal. These three are most important. Nasolacrimal canal, in infraorbital foramen, that's so much important. But the superior orbital fissure, so many structures passes through the superior orbital fissure, inferior orbital fissure, and the optic canal. This optic canal is present between the medial wall and the roof. That means the superior wall and the medial wall. Superior orbital fissure, it is also present between the superior wall and the medial wall. But the inferior orbital fissure, it is present between the, what is this wall? We called it inferior wall, superior orbital fissure. It is present between the inferior wall of the orbital cavity and the lateral wall, inferior orbital fissure. I am repeating again, we have the superior orbital fissure, inferior orbital fissure, optic canal. How we can localize the optic canal? Optic canal lies superior medial to the superior orbital fissure. Here we have the superior orbital fissure and this is optic canal. Optic canal is usually present in the medial wall. This is the medial wall. And what structures will form the medial wall? The lacrimal bone that lodges here we have the lacrimal fossa and it contains the lacrimal sac, greater wing of the sphenoid, the palatine bone, and the zygomatic bone. Not the zygomatic bone is present over there. The lacrimal bone, the palatine bone, these structures are present. So it is present on the medial wall, optic canal. Now the superior orbital fissure. This superior orbital fissure is present between the, I'm repeating again, this is the superior wall that is formed by the orbital plate of the frontal bone. And so it is present between the superior wall and the lateral wall. This inferior orbital fissure is present between the lateral wall and the superior wall. Inferior wall and the lateral wall. Repeating again, okay? It is a little bit confusing. Optic canal is present superior medial to the superior orbital fissure. Number 1 point, it is present in the medial wall. Superior orbital fissure, two fissures are present between the lateral wall. Between the superior wall and the lateral wall, that is the superior orbital fissure, and between the inferior wall and the lateral wall, that is the inferior orbital fissure. Now, any confusion at this point, write down in your chat box. Yes, lacrimal sac is on medial. Lacrimal sac or lacrimal fossa that lodges the nasolacrimal duct is present on the medial side. This is the medial side of the orbital cavity. This one is the medial side. Okay, getting my point? This is the medial side. And it is formed by the palatine bone, the orbital process of the ethmoid bone, the frontal and the lacrimal bone, and the sphenoid bone, small part of the sphenoid bone. So this whole is the medial wall. Here we have the lateral wall. Medial wall lodges the optic canal. Look at this slide. This is the optic canal. Medial wall close to the medial wall, but it is superior medial to the superior orbital fissure. This is the superior orbital fissure that is present between the superior wall and the lateral wall. Lateral wall का भी थोड़ा सा part आ रहा है ना? And just like superior orbital fissure, here we have the inferior orbital fissure between the lateral wall and the inferior wall or the base. Inferior wall is also called base. Any query up till now? The boundaries, which part is toughest? Lateral wall is the toughest, but it is still vulnerable to the accidents, road traffic accidents, motor vehicle accidents. Any confusion up till now regarding the superior orbital fissure, inferior orbital fissure, placement of the optic canal, the four walls, the base, and apex of the orbital cavity. Orbital cavity थोड़ा सा मुश्किल से learn होगी. The first one, that is the superior wall and the roof, single bone is involved, and it is easy to memorize. That is the orbital plate of the frontal bone. Superior orbital fissure, inferior orbital fissure, optic canal. Anushka, okay, Anushka. Anushka, I told you orbital cavity is made up of four walls and it has got three important fissures. Okay, superior orbital fissure, inferior orbital fissure, and the optic canal. Now I'm repeating again the four walls. Now listen carefully. The first wall is formed by the orbital plate of the frontal bone. Anushka, getting my point? The superior wall, this is called the superior wall or the roof. This is the inferior wall or the base of the orbital cavity, and it is formed major part by the maxillary, small part by the zygomatic bone. You can see in this slide it is highlighted by green. This is the medial part and medial wall, and it is formed by four bones. What are these four bones? Ethmoidal bone, lacrimal bone, sphenoid, and the palatine bone. Sphenoid and the palatine bone. This will form the medial wall. The lateral wall is the toughest, and I told you two bones participate to form the lateral wall. What are these two bones? The greater wing of the sphenoid and the frontal process of the zygomatic bone. Is this clear to you, Anushka? Is this clear to all of you? Then we will proceed further. Yes. The contents में सबसे पहले I told you the extraocular muscles, the nerves, the vessels, the fascia. Okay. Muscles, extraocular muscles. Then orbital cavity openings. Structures passes through these orbital cavities. Now, what are the structures that passes through the optic canal? Optic canal is situated superior medial to the superior orbital fissure, number 1 point, and it is present on the medial wall or at the apex. The point where the apex starts is simply the optic canal. Two important things passes through the optic canal. I made it very simple for you guys. Optic nerve and the ophthalmic artery. You can see in this slide, optic nerve and the ophthalmic artery. They both share a common tendon, a common durameter sheet. Durameter sheet for the nerve, optic nerve, and the ophthalmic artery is common. Here you can see in this slide the optic canal, and two important structures passes through this, optic nerve and the ophthalmic artery. Now the next orbital opening is the superior orbital fissure. Extraocular muscles are present. You can see in this slide, these are the extraocular muscles. Extraocular muscles, voluntary muscles, and the involuntary muscles. Extraocular muscles, we have the superior oblique, inferior oblique, 4 oblique and 2 recti, lateral rectus and the medial rectus. Superior, I'm repeating again, extraocular muscles, 4 recti and 2 obliques, superior rectus, medial rectus, inferior rectus, lateral rectus. You can see in this slide the tendon of the lateral rectus, and 2 oblique muscles, superior oblique muscle and the inferior oblique muscle. These are extraocular muscles. These are voluntary muscles. Then we have the involuntary muscles also, the levator palpebrae superioris, superior tarsal muscle, and the inferior tarsal muscle. But this is discussed extraocular muscles in your next slide. Now the contents that passes through the superior orbital fissure. There, what we talked about the superior orbital fissure. The superior orbital fissure is situated between the superior wall. Superior wall is also called the roof and the lateral wall. So the structures that passes through the superior orbital fissure is lacrimal nerve, frontal nerve, trochlear nerve, oculomotor nerve. These are the structures. Abducer nerve, 1, 2, 3, 4, 5. Nasociliary nerve, superior ophthalmic vein. 1, 2, 3, 4, 5, 6 nerves passes through the superior orbital fissure. Lacrimal nerve, frontal nerve, trochlear nerve, oculomotor, abducent, and the nasociliary nerve. Getting my point? This is the superior orbital fissure, and it passes so many nerves: lacrimal, frontal, trochlear, abducent, nasociliary, and the superior ophthalmic vein. Optic canal से क्या pass होता है? Two structures. What are these? Optic nerve and the ophthalmic artery. Superior orbital fissure से total 6 nerves passes through the superior orbital fissure. Now, the passage of these nerves, how it passes through the superior orbital fissure, is divided under the heading of lateral. What nerves passes laterally, medial, and the middlemost part. Lateral part, the structures passes through the lateral part of the superior orbital fissure. This is the lacrimal nerve, frontal nerve, trochlear nerve. These are the structures that passes laterally through the superior orbital fissure. Trochlear nerve, ophthalmic vein, superior ophthalmic vein, and asmostic branch of the middle meningeal artery. The structures that passes through the middle part. This is the middle part. You can see in this slide the 4 recti muscle, superior rectus. You can see in this slide here we have the inferior rectus, medial rectus, and the lateral rectus. They form a ring-like structure having common tendinous ring origin. They all form a ring-like structure. Superior rectus originates from common tendon ring, inferior rectus, medial rectus, and the lateral rectus, and they all are inserted into the sclera. And then they are inserted into the sclera. You can see. So we have the extraocular muscles, 4 recti and 2 oblique, superior oblique and the inferior oblique. They will form a ring-like structure, and due to presence of this ring-like structure, the superior orbital fissure is divided into middle part, medial part, and the lateral part. This is the middle part. Now, what structures passes through the middle part and how it is divided is superior orbital fissure due to the annulus ring-like structure that is formed by the 4 recti muscles. Now the middle part, upper and lower divisions of the oculomotor nerve. This is the upper division, superior division of the oculomotor nerve, inferior division of the oculomotor nerve. It passes through the middle part, nasociliary nerve, and the abducent nerve. These structures passes through the middle of the superior orbital fissure. Medial part, inferior ophthalmic vein. This is the middle part, inferior ophthalmic vein. It also passes through the superior orbital fissure and the sympathetic nerve plexus. So this is the arrangement of structures, how it passes through the superior orbital fissure. Yes, it is difficult to learn, to memorize for this. First, jot down the nerves, the 6 important nerves that passes through the superior orbital fissure. Only 2 structures that passes through the optic canal. Understand how to localize the optic canal, the localization of the superior orbital fissure, the inferior orbital fissure. This is the annulus ring, common ring for the 4 recti muscle that will divide the superior orbital fissure into the lateral part, middle part, and the medial part. Now, what left? The 3 important orbital openings. We have infraorbital foramen over there, just beneath the maxilla, also for the passage of the infraorbital vessels. This is the inferior orbital fissure. Now the structures that passes through the inferior orbital fissure, maxillary nerve, inferior ophthalmic vein, and the sympathetic nerve. These are the structures that passes through the inferior orbital fissure. Again, this is the inferior orbital fissure. You can see in this slide, maxillary nerve, which is the division of the trigeminal nerve, inferior ophthalmic vein. 2 veins are concerned with the orbital cavity, superior ophthalmic vein and the inferior ophthalmic vein, and single artery, ophthalmic artery. We will discuss in detail the branches of the ophthalmic artery, and the sympathetic nerves passes through this, the inferior orbital fissure. Look at this slide again. It's showing the recti, superior rectus, lateral rectus, inferior, and the medial rectus. Contents of the eyeball, again, orbital cavity, eyeball, the most important content, fascia, muscles, vessels, muscles में extraocular muscles, voluntary and involuntary nerves, lacrimal gland, which is present in the lacrimal fossa containing the lacrimal sac, orbital tract. Now, the fascia, periorbital fascia, also called orbital fascia. This is simply a connective tissue sheet loosely attached, adherent. Anteriorly, it is continuous with the periosteum of the bones that will form the orbital cavity, and posteriorly, it is continuous with the this is the, just wait, there it is present. This is the eyeball. Next slide. Yes, here we have the periorbital fascia. This is the periorbital fascia. This periorbital fascia is simply a thin, loose connective tissue that is present, that surrounds the orbital margin, and it is also continuous with the periosteum of the bones. Anteriorly, it is continuous with the periosteum of the bones that covers the orbital margin. That means the periosteum of the ethmoid bone, the periosteum of the frontal bone, the periosteum of the palatine bone, in सब के साथ continuous करेगी, but it is a separate loose connective tissue sheet that is termed as periorbita. Another name for periorbita is orbital fascia. This periorbita, what it do, it gives a flap-like extensions or sheet-like extensions at the superior pole and at the inferior pole. And just have a look on this slide, this one. And these are simply called orbital septa or orbital septum. Here we have the periorbital fascia, facial sheet, orbital sheet, and these are the extensions derived from this periorbita, and they are inserted into the eyelids. Now I'm repeating again, periorbita or the orbital fascia is simply the fascia of the eyeball. The fascia that is present, loose tissue that is covering the orbital cavity. Anteriorly, it is continuous with the periosteum of the bones of the orbital cavity, and it gives two flap-like structures at the upper end and lower end. These are simply called the orbital septum. Now here is the Tennant's fascia. This is the bulbar fascia. This is the fascia of the eyeball. Periorbital or the orbital fascia is the fascia of the orbit. Periosteum के अलावा एक और कवरिंग मौजूद है ऑर्बिटल कैविटी पे, ऑर्बिटल मार्जिन्स पे. Periosteum of the bone different है, ऑर्बिटल कैविटी और ऑर्बिटल मार्जिन पे एक और कवरिंग है. आईबॉल की कवरिंग अलग से, that is termed as Tennant's fascia or the bulbar fascia. Another name is bulbar fascia. This is the orbital fascia or the periorbita. Tennant's fascia is also called bulbar fascia. This Tennant's fascia extends from the here you can see the Tennant's fascia from the optic nerve to the sclera at the limbus sclerocorneal junction. It ends at the sclerocorneal junction, and this Tennant's fascia is pierced by the muscles. Number one, the sheet of the Tennant's fascia through which the eyeball can move easily. Eyeball के, this is the eyeball. I'm repeating again. सबसे पहले तो orbit है. This is the orbit. Okay, four walls of the superior wall, inferior wall, lateral and medial wall. This whole orbital cavity is covered by periorbita. Periorbita is also called orbital fascia. Yeah, इसी के अंदर eyeball है जो कि move करेगी easily. ठीक है? This eyeball is also covered by fascia that is called the Tennant's fascia or extend कर रहा है. This Tennant's fascia starts from the optic nerve and ends at the limbus. And this Tennant's fascia is separated from the sclera, eyeball की भी further layers in by space that is simply called the episcleral space. Now the whole fascia that covers the eyeball is pierced by two important structures. This is important. What are these two important structures? Optic nerve, number one, and the extraocular muscles. The muscles. Okay. orbital and the bulbar fascia. Orbital fascia का another name is periorbital. Bulbar fascia, Tennant's fascia. This is a slide showing the rectus muscle and the, you can see in this slide the lacrimal fossa that lodges the lacrimal sac, and the nasolacrimal duct is over there. That this is the medial wall, and if it is not present, the eyeball will comes in direct contact with the nose, and this will drain the tears. This all the glands and how the orbital cavity looks like, and then this is the eyeball. This part will move and it is present in the orbital cavity. Now the artery veins, we discussed superior ophthalmic vein and the inferior ophthalmic vein. Ophthalmic artery is the main artery that gives blood to the eyeball and the orbital contents. It is the origin from the intracranial part of the internal carotid artery. It enters through the optic canal. Optic canal the contents we have discussed. It enters through the optic canal along with the nerve, and the artery and the nerves share the common dura mater. Then it tears the slightly. Okay, optic nerve, internal carotid artery. Here we have the ophthalmic artery. They both enters, then it through the optic canal. Then this is the optic canal, middle cranial fossa. It enters. Then it gives branches. Branches are the main trunk, central artery of the retina, and the lacrimal artery. This ophthalmic artery एक common dura mater की sheet है, उसी में दोनों चीजें nerve भी और artery भी. Later on what happened? It pairs the dura mater and crosses the nerve from lateral to medial side. So cross करेगा and then it gives branches. It ends at the medial angle of the eye by dividing into two branches again, supratrochlear and the supraorbital branch. Branches तीन में हमने divide किया, main trunk, central artery of the retina and the lacrimal artery. Central artery of the retina is the very important branch, and the first branch, it is a blind artery, and if there is any occlusion, it can lead to complete blindness. Just have a look on this slide. Again, the optic canal, it enters into the orbit through the middle cranial fossa. Middle cranial fossa से foreign optic canal आ गया. Common sheet दोनों ने join करी. Then what happens? It pairs the optic nerve, the sheet, and then it divides into further branches. Branches में we have the main trunk. Then we have the lacrimal artery. Lacrimal artery gives further branches. You can see in this slide, central retinal artery and the main trunk. Central retinal artery is single artery. Lacrimal artery gives further branches, and the main trunk. Now the arteries that arises from the main trunk. Main trunk से anterior and posterior ethmoidal, supratrochlear, supraorbital, dorsal nasal branches, posterior ciliary branches. Slide में भी दिखा दूँ. Anterior and posterior, anterior ethmoidal, posterior ethmoidal, dorsal nasal is the last terminal branch, supratrochlear and the supraorbital. These are the branches that originates from the main trunk. Now the lacrimal artery. Branches from the lacrimal artery. Initially, ophthalmic artery arises, main trunk में branches थी, फिर lacrimal artery में भी branches, central artery कोई branch नहीं. Branches from lacrimal artery, lateral palpebral branch, recurrent meningeal branch, muscular branches for the muscles. अब सारे orbital muscles आ जाएंगे, 4 recti and the superior oblique and the inferior oblique. ये lacrimal artery. Long and short ciliary, they are lacrimal artery. Here we have lacrimal artery. Long and short ciliary are also involved in the main trunk. These are the branches for the lacrimal artery. Recurrent meningeal, zygomaticotemporal, zygomaticofacial, lateral palpebral branch, muscular branches from the orbital. Now I'm going for the clinical anatomy, then we will summarize our topic. But I told you the four walls are there, and the lateral wall is the toughest, but it is vulnerable to direct trauma, any blow or hit. Orbital CT scan can be used, gives good hint to the consultants to visualize the fracture. Uh, if there is a hard blow, what happened, backward displacement of the eyeball, intraorbital pressure will increase, and the fracture of the weakest part of the orbital wall. Ecchymosis can occur, facial deformity can occur, fracture of the walls can occur. Look at this slide. Uh, Mostly it occurs in the sports person and the motor vehicle accident. Bony fragments are there, and the orbital CT scan will exclude which wall is affected. It can impinge the bony fragments, the optic nerve, and the optic nerve can get damaged. If the bony fragments get down, and it can damage the optic nerve also, and so the fragment impinge, and again the muscular weakness can occur due to the nerve injury. So the orbital cavity and its wall, any fracture, any trauma can lead to the visual loss also, or it can lead to the deformity, facial deformity, ecchymosis, or fracture of the wall. Now, regarding the fascias, periorbital fascia and the tendons fascia, any confusion regarding the fascias? Write down in your chat box. Yes, any confusion related? Tendons fascia separated by sclera by episcleral space. Yes, tendon space also called episcleral space. Sclera से पहले एक और space मौजूद होगी, that is, ma'am, class time end. Yes, class time end, but still I'm asking, any confusion related to the topic? No. This whole topic covered this topic from KLM anatomy. Okay, KLM se covered this topic from the KLM anatomy regarding the orbital wall, the contents, the extraocular muscle we will discuss in detail, the recti, the levator palpebralis superioris, and the obliques, the nerve innervation. Superior orbital fission,